And that's really partly that, plus then the Primary Healthcare Access Program, which came into being in 1999 under Woolridge, gave a lot more grant money, plus access to Medicare and PBS. So we really revolutionised access to primary healthcare and to essential medicines, and we all know that makes a difference if you get it right. The other thing the NT Aboriginal Health Forum decided to do was to allocate resources in a planned manner according to need, and there was no competitive tendering. There were two providers, either an Aboriginal Health Service or the Territory Health Department, and no one else could come in and get that money. And we set about addressing the historical inequities that existed when the forum started in 2000. As I said, the worst funded areas were $330 per person, and the best funded areas were $1,500 per person. Now across the territory, remote territory, it's around $2,500 per person each, which is still not enough to deliver all of the core primary healthcare services, but it's a lot better than where we were. The other thing that happened is the forum developed these core services models, and we've done it in 3 iterations. So first iteration of core services really it said if you can get up to $1,800 per person, these are the services you'll get in primary healthcare. Once we got there, we then did the second iteration of core services, which said if you can get up to $2,700 per person, these are the suite of services you expect to get. The third version, which is only developed in 2011, takes us to another level, and we haven't actually worked out fully what it would cost to fund it, but I think it's around $4,500 per person to fund it. The difference between the third version is it includes, they're the 5 domains of comprehensive primary healthcare that we look at in these core services models. Clinical services, health promotion, corporate service and infrastructure, advocacy, knowledge and research, and community development, community engagement. So that we're saying if you want to have comprehensive primary healthcare, you've got to have activity in all 5 areas. And if you get funded to $2,500 per person, we've also said what sorts of activities and services and programs you get in each of those areas. But in the new model, the key gap areas are alcohol and other drugs, early childhood development and family support services, age and disability, and mental health and social and emotional wellbeing. And they're the areas that, in order to fund what we think is needed in those areas, it would get you up to around $4,500 per person. But certainly at Congress and Alice Springs, we do have a lot of services in these areas, and we've got around $3,000 per person for a town, not counting Medicare, not counting the PBS. So we have now been able to develop examples of what sorts of services and programs can be implemented in these areas, which are making a difference. And I'm going to go into some of the early childhood ones in a minute. But the key message here, and again, it's a message again that's against the neoliberal economic orthodoxy. Governments want to tender everything out. That's what FACSIA do with all their money. They go out to tender, and we end up with all these private providers coming in. People, sometimes international NGOs have never worked in Aboriginal communities, get the money, set up shop and provide a mental health service or provide some sort of service in a community. Santa Teresa had 12 mental health service providers, community of 600 people. That's what happens if you tender out funding and you don't plan, you don't deliver services according to need. So the whole NT Aboriginal Health Forum planning process, which has led to that improvement and has led to a planned and equitable improvement in primary healthcare, is being undermined by competitive tendering of new resources. And it's big money. FACSI have got a lot of money they're spending, and it's, I think, being tendered up against the wall at the moment. It's not going to deliver outcomes the way we have had. So that's access to primary healthcare, which has been an important part of what's improved Aboriginal health in the Northern Territory. And as I said, we can still make further improvements in key areas.